So good afternoon, everyone. My name is Diane Millette. I'm the Registrar of the College of Health and Care Professionals of British Columbia. And today I'd like to acknowledge that I'm calling in from the traditional territory of the Okanagan Syilx peoples and would invite any of you to share, if you can, in the chat, the traditional ancestral territories on which you are located today. But I'm very pleased to welcome you today to our virtual education session, which is part of our celebration, making a major milestone for the college. As of June 28th, 2025, we celebrated our 1-year anniversary. And it certainly is so hard to believe how far we've come in just 12 months and a number of days now. Bringing together 9 professions under a single regulatory framework has been no easy task, but we have made lots of great progress, and it's been certainly a year of change, collaboration, learning, making mistakes, acknowledging them, moving on. So on behalf of everyone at CHCPBC, I want to thank you, our registrants and the staff, our board members, committee members, for your patience, your feedback, and your commitment to working with us through this time of transition and transformation. So as part of our 1-year celebration, today's webinar is being offered really as a gift of learning to all of us. Regulation is more than just rules. It's about shared responsibility, including lifelong learning, which is essential for all of us as healthcare professionals, regulators, and I think that's shared by regulators across the country. So we're very, very pleased to welcome our speaker this afternoon, Dr. Zubin Austin. I'm sure some of you have heard Zubin speak before. Zubin is a professor at the Leslie Dann Faculty of Pharmacy and the Murray Koffler Chair of Pharmacy Management at the University of Toronto. He's been part of the University of Toronto since 1984, having completed 6 degrees at the university, from his entry-level degree to his PhD. Zubin brings with him an incredible knowledge, serving in both clinical and administrative roles in the field at Mount Sinai Hospital since 1988. Dr. Austin's research focuses on the personal and professional development of the health workforce, with an emphasis on the technical and psychological dimension of what constitutes competency in the practice of health professions. His research recognizes that artificial divisions between personal and professional development are counterproductive to the goal of enhanced quality and safe care. Zubin holds multiple awards for his outstanding research, as well as his work and impact as an educator. Among many other honors and awards, he has received both the President's Research Impact Award for the societal significance of his work and the President's Teaching Excellence Award for sustained contributions as a teacher. He's also been voted the Undergrad Professor of the Year at U of T by students at the Leslie Dann Faculty of Pharmacy, not once, but on 18 different occasions. So in his talk today, Regulation and Wicked Problems, Zubin will explore what it means to build trust and confidence between regulators and registrants, between healthcare providers and their clients, and between the college and the public. He'll also address the challenges of doing so in a time of social media, misinformation, and increasing complexity. Zubin also tells great jokes, especially about pharmacists, and I don't think there are any pharmacists on the call, so Zubin, you're free to add some of those as well. So Zubin's the plan for the session today is that Zubin will share his thoughts on this topic, and then we'll have a few minutes at the end for any questions or other conversation that the audience may wish to have. So please join me in welcoming Dr. Zubin Austin. Zubin, over to you.
Thank you very much, Diane, and thank you very much to the college for the opportunity to share some of this work with you. I am speaking to you today from the traditional lands of the Anishinaabe and the Haudenosaunee and the Mississaugas of the Credit. It is my privilege and honor to be able to live and work on this land. I also reflect that as a child and a grandchild of formerly colonized people, that provides me with some unique opportunities and responsibilities to advance the work of truth and reconciliation, which of course all of us do in different ways. And I'd encourage all of us to reflect on that intersection as well. The presentation today is focused on regulation and wicked problems. And to begin with, I would like to start by reflecting on the fact that I have spent for the last 35, 36 years my time being a member of a regulated profession in Ontario. My first degree in my professional background is as a pharmacist, and I think the joke that Diane was referring to about the my jokes that I tell about pharmacists is pharmacists are, of course, medication experts. And what do pharmacists as medication experts use for contraception? And the answer is their personalities. But I hope, as you'll see over the next hour or so that we have together to discuss these issues, we can bring much more to our conversation, not just about contraception or a single profession, but about regulation and the complexities associated with being a regulator and a professional in 2025. To begin with some disclosures, much of what I'm going to be discussing is part of a research program that I lead that is called Foresight. Foresight stands for the future of regulation in this era of skepticism, indifference, technology, and evidence collapse. And the Foresight Project at the University of Toronto is funded through a variety of different funding organizations that you'll see listed on this slide. And I am grateful for their support for the research that I'm going to be presenting today. Since it is a regulatory body that is hosting this event, perhaps it's appropriate for us to begin from a regulatory body perspective with what is going on in our world. The idea that regulators function to protect the public is something that we all recognize and respect, but it's becoming increasingly challenging given the nature of the real world public we see today. We live in a time of incredible political polarization. We live in a time of misinformation. We live in a time of competing political demands. And from a regulatory perspective, this has heightened significantly the complexity of the work that regulators do. The frontline professionals who actually provide the care and service to the public experience this on an everyday basis. As I mentioned, I am a pharmacist, and I can remember a time not too long ago, 5 years ago, in fact, where people would stand on their balconies and bang pots and pans together and, say how grateful they were for the healthcare heroes that were navigating through the early days of the pandemic. And within a couple of years of that moment, we saw, in my part of the world at least, assaults on nurses increasing in really alarming ways. We saw the shocking disregard of professional expertise. We see people marching down the main streets of big cities like Toronto or Vancouver, decrying vaccine mandates and denying certain parts of things that are, as healthcare professionals, we know and believe to be true. And all of these are significant challenges in the context both of professional work and of regulation. When regulators and professionals vow to protect the public, but the public is not this single monolithic entity, but instead a whole variety of sometimes quarrelsome, sometimes disagreeing, and frequently angry about the state of things, how do any of us do our job and do our job properly? Part of the reason we see so much complexity in the world today is, of course, because there are so many problems that are simultaneously challenging both professionals and regulators. Here is just a partial list of things that are challenging all of us at the current time. For example, climate change. Do you remember when we used to talk a lot more about climate change, where we used to like try to uphold carbon emission standards and reduce carbon footprints? And in some ways, it's almost quaint today to reflect on that time a year or two ago where climate change was a major public policy issue. And today, in light of so many other things that are going on, climate change doesn't seem to have the same compelling hold on us as it once did. In the context of health and healthcare, this is particularly unfortunate because the climate impacts of healthcare are now well documented, but not necessarily well understood. So, for example, if you took all the people in the world who actually provide healthcare, we would be the fourth largest country in the world, and we would have the third or the fourth largest global emissions in terms of greenhouse gases directly attributable to the work that we do. Between 10 to 15% of Canada's greenhouse gas emissions a year are directly linked to the work of healthcare professionals. And think of the irony there that in the act or in the desire to try to help people get better, the work that we're doing is actually making them more sick. And yet, what are professions and what are regulators doing about climate change as an issue facing the world? If you read the news yesterday, you will know that in the United States, the president has announced that it's important to unshackle technology and unleash the potential of big corporations to allow artificial intelligence to evolve very rapidly. We've all heard of artificial intelligence. We all use it, whether we know it or not. And we all recognize that there is potential value to artificial intelligence to improve our lives and our world. But most of us are also skeptical or concerned about unfettered capitalism driving the development of artificial intelligence and what impact that might actually have on our world. And now, in the United States at least, the current administration has decided to remove regulatory guardrails that were constraining the direction of growth of artificial intelligence. What does this mean for us as citizens? We have all lived through the experience of Facebook and social media. It started out as something that was sort of fun and just a game, but now we know about its malign influence on everything ranging from um, misinformation and disinformation transmission, to its influence on teenagers, increasing risks of social isolation, and some fundamental threats to democracy as we know it. And yet we're going down this same path, perhaps amplified with artificial intelligence. What do we as professionals, what do regulators need to do in an environment where the US government, at least, is taking a hands off approach to this? Another wicked problem of our time is something called dual loyalty. And this reflects a reality in many professions where many professions are increasingly being corporatized. No longer are professionals working by themselves in the individual patient's or client's interest, but instead working as employees of large for-profit corporations. Corporations have as their major mandate maximizing shareholder value, but professions have as their mandate serving the public. How do the professionals that run these corporations manage these dual loyalties? And what responsibilities do regulatory bodies have around this dual loyalty problem? There are other problems and other concerns ranging from globalization of our workforce, political polarization, rise of misinformation, and what most of them reflect is what many researchers are describing as a collapse of governance in today's world. Across the left and the right, across political parties and across different countries and jurisdictions, we are seeing an unprecedented decline in the trust that the public has in government and governance, and the faith that the public has that somebody is actually at the steering wheel and doing what's in the best interests of society. As that collapse continues, it has effects on the way people perceive professions and professional expertise, and it makes it incredibly challenging to ensure safe and effective work in any profession. Within this context, it raises important questions for professionals about what competence looks like in this age of skepticism, indifference, technology, and evidence collapse. Let's take a look first at this era of skepticism in which we live. The extent to which members of the public automatically and blindly believe what well-educated professionals tell them is long gone. If you are a professional, you know this. You know that people are using AI, people are using Google, people are talking to their neighbors, and they are developing parallel systems for problem solving and for identifying what it is they need. Within a healthcare context, this is sometimes referred to as the era of DIY or do it yourself medicine. Rather than consulting a professional and relying on a professional's expertise, people are using all manner of other information sources, some of them accurate, many of them not, in order to assess what they need. With this has come an era of not just skepticism in professional expertise, but in the actual systems that our society has structured itself on. Faith in the healthcare system to be there when I need it. Faith in professionals to do what's in my best interest, not what's in their best interest. And faith in government to manage effectively the systems that we rely on has reached unprecedented lows. And with that skepticism comes a desire in some ways to burn down the house. What we are seeing in many parts of the world, including Canada, is the belief that our current systems are beyond fixing and need to potentially be completely razed to the ground and rebuilt from scratch. And for those of us who are working in professions, those of us who are regulating professions, this is a fundamental challenge. Most of us who are on this call have recognized there are lots of problems in our healthcare system, but few of us believe you need to torch the whole thing. Most of us recognize that we need to fix what we've got rather than risk starting from square one. And this is increasingly a view that is not held by members of the general public. We also live in something that social scientists describe as an era of indifference. Call it media fatigue, call it compassion fatigue. But in many places today, and in many parts of society, there is frank indifference to the plight of others. There is a less than charitable instinct to help those who need help. There is an everyone for themselves kind of attitude that makes large public systems like healthcare systems in Canada difficult to maintain and difficult to sustain. And we're seeing incredible pressure in many parts of the country today, especially in British Columbia, actually, around the idea that we need to abandon public goods and instead revert to a each person for themselves type of approach, and the expansion of privatized types of public goods. We also live in an era of technology where all of us are aware at some level that much of what we do may in the years ahead be replaced rather than simply complemented by the rise of artificial intelligence. On the one hand, the rise of technology has been democratizing. Everybody has access to the same information that you and I have as healthcare professionals, and that should increase transparency, accountability, and openness. But on the other hand, when everybody has access to that information, it perhaps gives the impression that everybody is equally qualified to do everything. And as professionals, this is something that many of us have a hard time getting our heads around because we recognize that simply having access to information through technology is not the same thing as having a unique skill set that a professional possesses. Perhaps most alarmingly, we live in an era of evidence collapse. We live in an era where there are multiple truths that are contested. We live in an era where, for example, the head of the United States Food and Drug Administration is a frank skeptic of vaccines. We live in a time where ministers of health believe that they have expertise that perhaps professionals don't, and they ought to dictate to professionals how to manage their practices. As a pharmacist, in my narrow world of this, one of the things that's infecting my world right now is the belief that sunscreens are actually toxic and should not be used. In the same way that vaccine skepticism or other kinds of misinformation have spread for many pharmacists today, they are now battling a misconception or misinformation that sunscreens should not be used. And as most of us who believe in evidence will recognize, sunscreens do have proven benefits and ought to be used widely, particularly during this era of climate change. And yet, rather than focusing on public education and helping people to get the best out of products that are available, we are combating misinformation. And in the process, we are being labeled in a very negative way, further downgrading our social status as professionals. Now, in this era of evidence collapse, of skepticism, of hostility, of indifference, where does this leave professionals and the regulatory bodies that bind those professionals? What we're seeing, not just in the United States, but here in Canada and the United Kingdom and globally, is that the regulation and the structure of professional work as a public good is under siege as has never been before. It has been politicized in ways that we've not experienced before, and it really starts to speak to some significant existential questions about what it means to be a professional. Faith in regulation as a tool to safeguard public interest is equally eroding rapidly. It's important actually to pause for a moment and think about the unique and important role that professions have in a society. Professions as we recognize them today have existed for about 700 or 800 years. And originally, professions were, or they used to be called historically, the learned professions, occupied a unique place in society. At a time where few people could read or who had access to education, members of the learned professions had unique knowledge that translated into very important skills that made people's lives better. In exchange for making people's lives better, professionals enjoyed certain perks, including social prestige, making a very good living, and opportunities to do certain things that members of the general public could not do on their own. The current structure of professions across the world evolved from a time where professions existed as a unitary concept. What we today think of as a regulatory body or a professional advocacy group or educational institutions as three separate elements of a profession were all conjoined into a single organization. These used to be called the guilds. And 600 years ago, guilds were places where you went to school to learn to be a profession, but guilds also advocated to governments, to the state, and to the public for their special professional role. And the very same guild also was the regulator for a profession, ensuring that everybody in that profession was safe and competent to be a member of that important field. In that structure where guilds were regulators, educators, and professional advocates, there was significant potential for abuse. And over about a couple of 100 years period, what evolved around the world was the separation of a guild into constituent parts. So today, you go to a university or to a post-secondary training institution in order to become educated as a profession. Today, you have a regulatory body whose primary mandate is to safeguard public interest. And you have a completely separate professional association who is there to advocate for what is best for the profession. That separation into those three different components helped to reduce the power of professions in society. And that was a significant concern for governments. In an era where guilds predominated, it meant that there was a force in society that was more powerful than the government. Think particularly of a large profession like medicine, where the educational institution, where the professional association, and where the regulator were all conjoined into one group. that medical guild was more powerful than most elected governments. We recognize today, of course, that that's not a good situation. And in large part, the separation into different components that we have seen across professions has been in order to constrain the potential power of the professions. But in separating and reducing the power of professions, we have now perhaps created new problems that speak to the skepticism, indifference, technology, and evidence collapse that characterizes our current world. Much of this speaks to questions of competence, and in this day and age, how competence and our understanding of misinformation and disinformation intersect. For a moment, then, I would ask you to reflect on how you know the things to be true that makes professionals competent. Think about things that perhaps you haven't thought very deeply about because you just know them to be true. Things like vaccines work, fluoridation is a good thing, a person is innocent until proven guilty, gender and sex are different, due process matters, and evolution happens. To a greater or lesser degree, most of you probably just accept most of these statements. But we also know that many, many people, including the head of the Department of Health in the United States, don't believe that vaccines work. There are at least 3 states in the United States that have now made it impossible for people in their state to have fluoridated drinking water. Utah, Florida, and Louisiana have recently passed legislation requiring municipalities to stop fluoridation of drinking water, despite abundant evidence that fluoridation has been of net benefit in terms of dental health. We know that, again, in the United States, the principle that a person is innocent until proven guilty may not apply if you are an immigrant or if you are in the country and your immigration status is not settled. The things that many of us have known or assumed to be true and therefore define us not simply as competent professionals, but also as competent adults are being undermined, questioned, and discredited in ways that are really difficult for us to imagine and almost impossible, it feels sometimes, for us to do very much about. Many of the problems of regulation and professions, the so-called wicked problems like that we've discussed so far, stem from a collapse of what social scientists call our knowledge ecosystem. If we return back to these list of the things we just know to be true and think about, well, why do you think these things are true? Have you read studies recently about fluoridation of drinking water so that you know that fluoridation is a positive thing? Well, probably most of us haven't, but we trust the people who made those decisions. We have lived with fluoridation for such a long time, we simply accept it. How is it that we know the things that we think to be true? How is it that we know that? The answer to that question is complicated and it speaks to a concept called a knowledge ecosystem. A knowledge ecosystem is part of a society that allows us to understand the things that we accept as truth. We have lived through many different kinds of knowledge ecosystems for generations. Thousands of years ago, our knowledge ecosystem was governed by monarchs. Kings and queens would tell us, this is what you have to believe, and well, we would just believe them. And on other times and places, religious authorities defined the perimeter of our knowledge ecosystem. Religious authorities would tell us, this is what is truth, believe it, and we would simply do so. The knowledge system that we live in today is far more complex and has many more different players in it. Our knowledge system of today consists of producers, amplifiers, foot soldiers, guardians, and end users. The producers in our knowledge ecosystem today are people like me, researchers, people who work in universities, Perhaps people like you, if you are a clinician scientist or a researcher working in a healthcare setting. Scientists, universities, researchers, artists, people who produce certain works that help us to understand or define the world that we are in are the starting point of our knowledge ecosystem. The work that producers generate are amplified by teachers or by the media. These amplifiers of knowledge are essential. These are the people that transmit knowledge to the next generation. They're the ones that amplify truths so that they are understood across society. Within this model, the foot soldiers of the knowledge ecosystem are frontline professionals, people like teachers or pharmacists or nurses or the professions represented by your college. These are the professions or the individuals who take the science and the knowledge that is produced and amplified and convert it into day to day work and day to day action. In this model, the guardians of this entire system are regulatory bodies like yours. They are responsible for ensuring that the foot soldiers are actually applying what knowledge has been produced safely and effectively and reliably and in the public interest. Because the end user of this knowledge ecosystem is the general public who has benefited from things like vaccines, things like due process, things like fluoridation. This intricate system that has been in place for about 150 years is being threatened and undermined in astonishing ways right now. And this is at the root of where so much of the complexity of professional work and regulation today is actually being seen. It used to be so much easier for professionals and regulators in a time where this kind of a system seemed to work. At its worst, what this system did was perpetuate inequities. What it did at its worst was create unquestioned acceptance of things that it should not have. Even those producers recognize that science changes, science evolves. What we know today we may not know tomorrow. Think, for example, of some of the significant shifts that we've experienced over the last 20 years with respect to the understanding of treatments for menopause. There was a time where hormone replacement therapy as a treatment for menopause was considered to be a gold standard. There was a time when the Society of Obstetricians and Gynecologists of Canada said that every menopausal woman ought to be taking hormone replacement therapy. This was the time actually when I just started my career as a pharmacist, and I can remember as a very young pharmacist at that time, my mom was going through menopause, and I was pushing her to say, "Go see your family doctor. You need to start taking hormone replacement therapy." And my mother, who was a teacher, very well educated and smart, very politely looked at me and said, "Well, this just doesn't make sense to me, actually." Because what you are saying is that, basically every woman who reaches a certain age is going to go through menopause, and you're saying that every single woman needs to be medicated for this? How does that make sense? As an unquestioning foot soldier of the time, I was simply taking what was being produced and amplified and trying to impose it on my mother. Shortly after having that conversation with my mother, of course, if you know the story of hormone replacement therapy, you will know that the scientific consensus changed very, very quickly. And all of a sudden, it appeared that hormone replacement therapy was the worst possible thing. And events like that help to undermine public faith in the production and amplification of knowledge. More recently, we have seen that with the on again, off again guidance during COVID around vaccinations, masks, PPD, spacing. As healthcare professionals, we may recognize this as the reality that scientific knowledge is not produced in a straight line, that things we know to be true today sometimes are not true tomorrow, and that's just part of the scientific process. But of course, all of that has contributed to undermining the value of the knowledge ecosystem for the general public. And it has made our lives and our work so much more difficult. In the context of professional work and in the context of competence, all of this is raising some significant questions and concerns with respect to how we can assure the public's faith in the work of professions and in the work of regulatory bodies. There's much that we could discuss about this, but I'd like to maybe focus on one particular slice of this that is probably relevant to most people in the audience, and that is the concept of quality assurance. In an era where scientific knowledge continues to evolve, where what is right today may not be right tomorrow, but also in an era where evidence collapse is occurring, skepticism, indifference, technology is advancing, how do we ensure that the professionals that are working today are actually competent? And what does competence actually mean? Am I being a competent pharmacist when somebody comes to me and says, you know, sunscreens are a big scam and you shouldn't sell them? And I say to them, you're wrong. Is that being competent? Or am I being competent if I say, well, that's your opinion, you can do whatever you want, and simply let them continue to believe and perpetuate misinformation? What competence looks like in this era of evidence collapse is an incredibly challenging thing to understand. In a similar context, trying to understand what regulators need to define as competence in this time is equally challenging. Historically, when we have thought about quality assurance and competence of practitioners, we focused very much on measurement, and in particularly measurement of knowledge. Many different quality assurance programs have evolved across the country to ensure competence of people in a profession. At their most straightforward, it has involved counting of continuing education hours. You have to get 20 continuing education hours each year and report it to your regulatory body, and that proves you're competent. To more elaborate systems, including retesting, where every 5 years or so you have to do a test to prove that you continue to know and understand the content of your field. In the current era, many of these kinds of approaches don't seem to actually address the real needs of professionals. And this now starts to raise a whole other dilemma for regulatory bodies in particular. While there may be a decline in faith and trust in professions amongst the general public, one of the things my research group is also tracking is a decline in faith in trust in regulatory bodies, both with the general public and with practitioners themselves. If we think about what we define as competence in 2025 and what the experience of professionals in the field actually are today, we start to see that a major challenge that regulators face is that they may not be defining or framing competence as clearly as the public and professionals want them to. If all we're doing is asking professionals to count continuing education hours, are we actually ensuring safe and effective practice? If we are testing them on procedural knowledge, are we actually focused on the real issues that they face? For example, inequality, corporatization, climate change, truth and reconciliation, trauma-informed care, culturally sensitive care, etc. We recognize today that what makes somebody a valuable and impactful professional is far more than simply knowing the facts of their profession. Of course, you need to know the facts of your profession. But if that's all you have, you're not going to be successful as a professional and you're not going to really meet the needs of your communities and your societies. The elephant in the room, then, for regulators and for professionals is that after 20 years of spending significant time, money, and effort in developing and deploying all manner of different quality assurance and continuing competency and competency assurance mechanisms, we don't necessarily have a lot of evidence that this has actually done much benefit. when in fact we do have increasing evidence that the things that professionals and regulatory bodies are doing may actually be eroding faith and eroding trust. We are starting to see increasing skepticism on the part of the public of the entire structure of professions, but we're also seeing within professions skepticism about the value and role of regulatory bodies themselves. And so it is perhaps time for all of us to reconsider why regulation is so important, why self regulation in a Canadian context in particular is so important, and what we need to do collectively in order to defend it from forces that would undermine it. And make no mistake, there are significant forces that would undermine it. Again, just look south of the border. Remember the Department of Government Efficiency? Remember, and to this day, what we're seeing is attempts to deregulate all manner of public goods and public life in the name of cost savings, enhancing efficiency, or unleashing innovation. The idea that somehow regulation is the enemy has now gained currency in many parts of the world, including in Canada. And as professionals and as regulators, this is something we need to take seriously, and I would argue with great alarm. As professionals, we know that regulation is valuable. Even though few of us have lived in a time where there were not regulations around professional work, we can imagine the Wild West of anybody claiming to be able to solve any problem. We can think about what happens when you don't regulate the quality of drinking water, when you don't regulate medications, when you don't regulate the people that prescribe medications or dispense medications. Most of us have faith that regulation is a good idea, even if there are problems with the way regulation today is being operationalized. But we live in a time where there is a tendency to want to burn down the house rather than fix it. And as regulators and professionals, we need to be very conscious that we have an important role to play in vigorously advocating for regulation as a concept. It's important that when I use the term we need to advocate, that this is not that we're advocating for professional self-interest. We are not advocating for professionals to make more money necessarily or to have greater powers. What we need to do is remind the public, remind government, remind organizations that while there are problems with regulation as it's currently being experienced, to eliminate regulation or to completely devalue it creates many more problems than trying to work collaboratively to fix it. These are critical questions we all need to face because in a world of artificial intelligence, where the impacts of climate change, corporatization, globalization, and polarization are accelerating, what does it mean to regulate in the public interest? How can we regulate in the public interest when half of the public believes one thing and the other half believes another? How do we represent the public when there are many loud, squeaky wheels that claim to speak for people, but we don't really necessarily know what the rest of the society is thinking? How do we regulate in the public interest when those of us attending today's webinar would immediately be labeled as an out of touch and educated elite, only interested in our own self interests? All of these are challenging because, of course, we have to find ways of addressing the kinds of disinformation that exist about regulation today. We need to be more vigorous than perhaps we have been in defending regulation. If, in the name of not appearing to be self interested, in not appearing to advocate, we simply sit back and allow misinformation to spread, we are going to be in trouble. Let me give you an example from my own province of Ontario. About a month ago, our Premier, Doug Ford, publicly stated his interest in exploring a new way to appoint judges in Ontario. This was in response to a court case that did not go his way. His government had an interest in dismantling the intricate series of bike lanes that had been built in the city of Toronto. Um, Doug Ford is well known to be a proponent of what he calls the war on cars in Toronto, and he wanted to actually remove bike lanes that already were in place and passed legislation to do so. A court ruled that he could not do that. This was a municipal issue, not a provincial issue. In response to that, Doug Ford suggested we need to now elect judges the way they do in the United States rather than appoint them. Many people like me became quite alarmed. This is not just some joker on a street corner. This is the premier of the province leading a majority government who has a track record of expeditiously passing legislation. If that was something that he wanted to do, it's possible he could do it. Many of us look in alarm at the way the judiciary in the United States has become incredibly polarized. Um, and in part, it's because judges are elected there. And that is not something many of us in this province or this country would like. And in this context, when the premier is saying something like this, where was the Law Society of Ontario? Where was the regulator for the profession of law? Crickets. The idea here is that when politicians, members of the public, and others use politicized language and try to inflame polarization, we are going to collectively need to find ways of respectfully but firmly addressing the misconceptions that are at the heart of the argument. This is challenging because we do live in a time of public polarization. We do live in a time where both professionals and regulators are somewhat gun shy and hesitant to appear to be advocating for their profession. But we need to advocate for regulation because most of us have faith that the structures on our systems, while imperfect, are better than no structures or systems at all. Within this context, then, so much. There are many opportunities for us to reconsider day-to-day operations of regulatory bodies that might actually help to enhance practitioners' faith in regulation and, by extension, the public's faith in regulation. And to that end, I'd like to share a current example of an approach that's being used in Ontario that may be resonant and may be something worth considering in British Columbia. In some of the work that we have done examining competency and the framing of competency assessment by regulatory bodies, one of the stories that comes up is that practitioners who are required to undertake some form of quality assurance audit as part of their annual renewal of licensure like certain things about the process that the regulatory bodies use. They like to have the opportunity to reflect on and consolidate the experience. They like to document a sense of accomplishment, document a source of information for the future, etc. But perhaps more impactfully, there are many, many things that we hear from practitioners about the ways in which the operations of regulatory bodies antagonize them. For example, many of the quality assurance programs in Ontario that regulatory bodies use appear to be bureaucratic hoops that are time consuming, focus on the wrong thing, and make us fear regulators or at the very best be irritated by them. One of the most frequent ways in which practitioners interact with their regulatory body is through the annual renewal of licensure. And it is that annual renewal point where there are certain hoops that need to be jumped through. When we explore this issue further, one of the things that we're learning is that the way in which regulatory bodies interact with their registrants is not simply irritating and off-putting, but is increasingly undermining faith in regulation as a concept. It hasn't reached the point yet where most professionals believe we need to burn down the whole concept of regulation, but it is starting to demonstrate some alarming lack of faith in the idea that professions need to be regulated by professionals themselves. This is an incredibly problematic issue because ultimately the regulated and the regulator need to work together if we are to tackle the misinformation, disinformation, politicization, and polarization that we're seeing across society today. When professionals and regulators are at odds with one another, that makes the soil incredibly fertile for misinformation and weaponized disinformation to actually spread. And so this becomes an incredibly important issue. Some regulators have started to recognize that one of the ways to not only build support for regulation as a concept, but to build rapport with individual practitioners is to focus on developing more meaningful quality assurance programming that addresses the real world needs of registrants. This serves twin purposes. First, and in the name of public protection, it allows the regulator to demonstrate that they are there to serve and protect the public, but to do so in a manner that supports and respects the practitioners that are regulated. Today, most of our data in this space suggests that practitioners view their regulatory bodies, if not as the enemy, but as something to be avoided, or an organization that is just best left alone. That kind of attitude starts to fester over time, and it leads to the kind of lack of faith in regulation that we're starting to see on the part of at least some members of professions. Instead, trying to find ways to engage with registrants, to build trust, to build rapport in ways that are meaningful for them is a process that's currently underway in some professions in Ontario. The profession that I would like to focus on or give you an example of is one that many of us might not necessarily spend a lot of time thinking about, and that's the dental hygiene profession. The College of Dental Hygiene Hygienists of Ontario has about 16,000 registrants, and dental hygiene is one of the larger professions in Ontario. There are some unique features of this profession. It is overwhelmingly female dominated, and they generally work in employment settings run by dentists, so very corporatized settings. As a result, this overwhelmingly female dominated profession has very little autonomy or control over their workplace. Interestingly, there are a vanishingly small number of complaints by the public to the College of Dental Hygienists of Ontario. Very few people complain. There are very few disciplinary cases. And so, one of the main reasons for a regulatory body to exist, to manage complaints from the public, this is not a big feature of the dental hygiene profession. Like other professions, health professions across Canada, the scope of practice of dental hygiene is expanding, but in an asymmetrical manner. Dental hygienists aspire to do more than simply clean teeth. They want to be more involved in diagnosis and direct treatment, independent of dentists. They want to be involved in public health and public education. And across Canada, we're starting to see scope of practice expand. So, for example, in some provinces, dental hygienists can order x-rays or order certain kind of tests. They're allowed to prescribe certain things independent of a dentist, and they're allowed to be involved in direct provision of education. All of these kinds of features make dental hygiene an interesting profession to consider in light of what we've spoken about, particularly with respect to increasing hostility towards what we often just take for granted, the idea that fluoridation of drinking water is a thing that is good and should be supported. The quality assurance process for the College of Dental Hygiene Ontario is a very traditional one. It involved multiple pathways and random selection. So once every 5 years, a dental hygienist might have been called to submit to the quality assurance program. There were a variety of different tests that the dental hygienist would do, submission of a learning portfolio, some kind of a self-assessment audit, and quite a lot of paperwork, frankly. These different pathways are encapsulated on this slide. But the important thing is not necessarily what the pathways were, but a report that was commissioned about this process that highlighted some hostility towards the regulator that flowed from this process. In the name of public protection, the regulatory body was imposing a series of requirements on registrants to, in essence, from the dental hygienist perspective, simply jump through a lot of hoops that took a lot of time with minimal value in return. Particularly in the context of a profession with very low incidences of complaints or discipline, this was starting to breed some hostility towards the concept of regulation. Do dental hygienists even need to be regulated? This is just a lot of time, money, and energy. Just let us do our own thing and leave us alone. This led to some real concerns about what the regulatory body could do in order to better engage members of the profession itself. The regulatory body recognized that they needed regulated professionals themselves to stand up for regulation. When people questioned, do we really need a College of Dental Hygienists? The first people who should say, yes, we do, ought to be registrants themselves. They needed to see value in regulation. Because if they saw right value in regulation, they could then explain to their patients, to their dentists, to the general public, to their neighbors and their friends why regulation mattered. As a result of all of this existential soul searching, an entirely new QA model began to evolve within the College of Dental Hygienists. And perhaps the most important element of this was the shift away from bureaucratic so called make work exercises towards a peer circle model of quality assurance. The peer circle model substituted a variety of different tests and self assessments with opportunities for dental hygienists to actually come together in a safe space to discuss the real world problems they were experiencing. And there were lots of them. Dental hygienists, like every profession, have lots of real world problems, but they don't necessarily have a place they can go to safely ask for help. Like many professions, dental hygiene typically works in isolation. Dental hygienists work by themselves. They don't have a lot of control over their workplace environment. It's the dentists who are trying to save a lot of money and don't want to buy them autoclaves, for example, that govern their working conditions. And they had problems they wanted to talk to people about to try to get solutions for, but they didn't have a place to go. The regulator recognized that a very important service they could provide that would also help to safeguard the public would be to develop peer circles, opportunities to allow dental hygienists to come together in a safe environment to say, what do you do when there is a patient that is like this? Well, this happened to me, and I'm not sure I did this right or not. This is what I did. Should I have done this? Rather than fearing the regulator and the sanction the regulator could actually impose, this shift to a peer circle approach not only amplified the value of the regulator in assembling this, but also made the regulator a support for the profession. One of the things this lesson has taught the regulatory community is that testing alone is ineffective and insufficient. We can't keep asking practitioners simply to jump through hoops and saying, we're doing this because it's in the public's best interest. It's highlighted that regulators have educational and practice development responsibilities and opportunities. And it's also helped us to recognize that the best way to safeguard the value of regulation is to ensure that the first people to defend regulation are going to be those foot soldiers in the knowledge ecosystem, the people being regulated themselves. When the people who are being regulated themselves recognize, appreciate, and value regulation, that is how the whole idea of regulation is going to be presented to the public. There are so many other issues that we can discuss, and in the interest of time, I think I will cut it short and leave some time for discussion. But what I'd like to suggest then is that all of us, whether you are a regulated professional, or you are a regulator, or you are a member of the public, or you are a representative of the government, have an interest in trying to understand what is going on in society today. The misinformation, disinformation, and polarization we are experiencing is not something to simply be laughed off. Similarly, it is not something to be so fearful of that we retreat and do nothing about it. The time is coming where those of us who believe in the systems and structures that we have in place today, imperfect though they may be, are better than nothing at all. And we just need to look south of the border to see what happens when we allow politicians to dismantle things that simply need to be improved. We all need to work together, regulators, professionals, governments, bureaucrats, This knowledge ecosystem, imperfect though it has been, has delivered tremendous benefits for the public and for each of us as citizens. We need to defend it, but we cannot do that on our own. We need to work collaboratively in ways that allow us to demonstrate to the public, to professionals, to everyone that regulation is valuable, that regulation matters, and that we want regulation to improve. Don't throw the baby out with the bathwater. Don't burn down the house, but figure out ways of making what we've got work better. I firmly believe we can do that. And as the example of the College of Dental Hygienists in Ontario point out, there are creative options and solutions that people are working on today and that we can actually share and learn from. Let's do that. I am a firm believer that we have things pretty good. There is Science is a good thing, research is a good thing, evidence-based practice is a good thing, regulation is a good thing, professional work is a good thing. Finding ways to make this work more effectively is all of our responsibilities, and we can do this if we take the time to start now building the networks and collaborations we need to demonstrate to the public the value of what we do. If you are interested in learning more about any of these, here's some suggested readings that you might find helpful. And I look forward to any questions, reflections, or thoughts that you may have on this. Thank you so much for this opportunity to share some of this work and looking forward to hearing what you have to say.
Thanks so much, Zubin, for your thoughts. And I know that Michelle is going to be monitoring I don't know why my video isn't working, but I doesn't appear to be, even though it's turned on. Um, but Michelle's going to be monitoring the question and answer. So I'll give people just a moment to add their questions. But I will put in a plug for peer circles because Zubin, we actually have some professions in our mix of 9 that have
Hmm.
used historically peer circles. Very, and one profession in particular use them in collaboration with their professional association.
Yeah,
So,
I believe the College of Dental Hygienists actually learned a lot from British Columbia on that particular point.
yeah, and it's certainly something that we will look at as well. So I'll wait for Michelle to triage some of the questions. I'll just start with, when you were talking about the era of skepticism, and the uncertainty that that brings, like one of the thoughts I have, or one of the questions I have, is what's the economic impact of that? When I look at the impact of tariffs, for example, on investments, does that translate into healthcare and concerns about investing in professions because there is this skepticism and uncertainty about where people are going to get their information, et cetera. I wonder if there aren't broader impacts that we've never really thought about.
Yeah, I think it all fits in, for me, it all fits into this bucket of creating an environment of uncertainty. And in the environment of uncertainty, and it creates this every person for themselves kind of environment. What we're seeing is the decline in the authority or the power of the of the professional or expert part of society, and the rise in the power of a highly political type of character in society. And they're they're sort of a we thrive on chaos type of a mentality that seems to exist today, which is so antithetical to what most professionals believe and how we thrive. We don't thrive on chaos. We actually thrive on science. We thrive on evidence. We thrive on regularity. We thrive on predictability.
Mhm.
And sanctions and tariffs and evidence collapse are all part and parcel, I think, of a bucket that it continues to undermine.
Mhm.
I think the challenge that we all face is that we're a bit like deer in the headlight right now with this, that we just don't know what to do with all of this. So we either laugh off misinformation or we retreat and say, oh, it's not our lane. We can't actually get involved. I can give you another example. Sorry, it's an Ontario specific example. So recently, this actually happened to a colleague of mine. A colleague of mine is an emergency room physician at a large downtown Toronto teaching hospital, and she wrote a sort of an op-ed in a major newspaper talking about how gun violence is a public health problem. She works in an emergency room, and she gets a lot of gun violence related consequences in that emergency room. She so and that as a physician, she believe we need stronger gun control legislation. This is affecting her work, et cetera, et cetera. Some gun rights proponents actually took issue with her perspective, filed a complaint with the College of Physicians and Surgeons of Ontario, and that complaint actually was investigated. There was a whole sort of process. Ultimately, there was no malfeasance, or there's no misconduct that was found, but she had to go through an entire process with her regulatory body as a result of that. This not only was really distressing for her, but for many physician colleagues and many professionals in general, because precisely at a time where she would have hoped and others would have hoped that the regulatory body would have had her back and said, no, we're not going to investigate this. We're
Mhm.
not going to put you through this ringer because what you said is actually accurate. In fact, gun violence is a public health related issue. Um, we're going to support you. They instead went down the lane of saying, well, no, we have to investigate everything, bar mandated, and put her through the ringer. Instances like that so undermine professionals' faith in regulation. And for a good number of the public, because this story became quite public as well. The other people in the public going like, really, you're putting this doctor through the ringer for this? These are the kinds of small situations I think we need to be really conscious of and recognize that we cannot simply do things the way we've done in the past, because in many ways that simply perpetuates the issue.
Thank you, Dr. Austin. I think we've lost Diane. She might have some connectivity issues, but I
Oh,
do
okay.
have a number of questions. I'm hoping you could help us with some.
Sure.
Time for all. This individual asks, do you have any advice for those of us newly in a multi-profession college to help and cooperate with our regulators to increase the quality of services delivered to the public in the context of what are and should be vastly different standards for competence across professions?
Yep. So that's a great question. The tension we feel experience right now is the sense that many regulatory bodies may appear to be these sort of very disinterested, bureaucratic, inefficient, and costly kinds of entities. And that's what makes them ripe for certain politicians to say, just get rid of the whole thing in the name of cost effectiveness. It is essential, I think, for regulatory bodies as large organizations to really be conscious of operational efficiency and really be very clear about what their mandate is. Where there should be significant alignment between what regulators want and what professionals want is in upholding standards and scientific consensus within a profession. The idea that somehow a regulatory body for dental professionals is not making a stand on fluoridation, or that a regulatory body for physicians is not supporting a physician talking about gun violence, or the Law Society is not saying, no, 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 we do not need elected judges. Regulatory bodies in particular may need to learn a new skill set around public engagement, public communication, and public advocacy. Not the kind of advocacy that's focused on professional self-interest, but the kind of advocacy that is focused on reminding the public of the importance of evidence, of the importance of of the importance of science, of the importance of professional work. And part of the way we have to do that as well is to ensure operational efficiency. So, for example, aligning standards and practices across multi-professions in a multi-professional thing. So those operational elements are things that are scrutinized. And when they are not where they should be, it undermines the regulator's case in other areas with respect to the value and need for regulation. Thanks for the question.
Yeah, thank you. And I think we have Diane back. I have another question for you. Does the role of a regulator include modeling competent practice as well as protecting the public?
So regulatory practice as a form of professional practice is an incredibly essential element. And it goes back to the idea that one of the things that has made regulation in general, not just of professional work, but regulation in general, vulnerable to political weaponization is the reality that it hasn't been as operationally efficient. It hasn't been as focused. It hasn't been as effective as it could or should have been. A lot of a lot of that inefficiency has historically been excused by saying things like, oh, but we have to safeguard the public's interest. For many years, my own regulator, the College of Pharmacists on the Ontario College of Pharmacists, they would very publicly proclaim, we are not we are here to protect the interests of the public, not the interests of the profession. And while on one hand that is true and makes sense, that is not a very good way of winning friends and influencing people. When by design your systems seem to antagonize professionals, why are we going to actually stand up to defend you when regulation comes under threat? There's a movement some of you may be aware of in regulatory practice called kindness in regulation. And the whole kindness in regulation idea might sound a little bit waffly, but it makes a very important point, and that is the idea that the fiercest advocates of self-regulation ought to be professionals themselves. They're the ones that should be defending regulatory bodies to governments, to patients, to political extremists who want to burn the house down. And how do we get them to be those fierce advocates? They need to see some value. They need to feel that, okay, yeah, they need to see that the way you protect the public the best is to work collaboratively with us to do so and engage us and help us. Don't simply exclude us and say, we protect the public, but we do that by beating up on you. I am happy to say that, virtually every regulator I talk to today, they're making so many strides to find ways of engaging their registrants, and that is so central to the overall project of defending regulation from political weaponization.
Maybe Michelle, if I can add to that, and I think Zubin in British Columbia, we have seen a fair bit of political interference. Amalgamation is an example of that. Our amalgamation was not voluntary, it was mandatory. So some see that as political interference, but also, there's more governance reviews, there's more oversight. And so while I think that's a reality of what I call now sort of self-funded regulation as opposed to self-regulation, it is the reality of what we're working with. But it's not all bad, right? There are some elements of political partnerships and conversation that actually are helpful to both the public and to the profession. So I think part of it for me is just, the notion of building trust and credibility in an agency like ours is a really important imperative. And it takes time, right, to do that, because
Yep.
the downside of not being seen to be trustworthy is really of no benefit to anyone.
Yep.
And so, yeah.
As the gun violence example pointed out too, that in an attempt to appear to be impartial, and say, oh no, we're going to investigate this and we're going to put this physician through the ringer and make them jump through all of these different hoops, etc. That sent a very strong message, not just to other professionals, but to other members of the public as well. And so it is challenging. But if what is a like if the root of all of this is where is the science pointing us today? Where is the evidence pointing us today? It is upholding that professionals and regulators can and should agree on.
Thank you. And I think we're at time. Diane, did you want to close?
Well, thanks everyone for joining us today. I hope that you enjoyed this webinar and are leaving with some new thoughts about building confidence in the various partnerships we have. Zubin, thanks as always for your insightful and thoughtful comments. Looking forward to reading your new book when it comes out. And for those that haven't had a chance to read Zubin's article, which was one of my favorite reads when it came out a few years ago, it's called The Regulation of Wicked Problems, Opportunities, Responsibilities, and Threats. And it's a really interesting read. But he ends in that article by suggesting that the approach to managing the problems that we're all facing really involves building coalitions between diverse stakeholders and organizations. And it's so true. Like not any one of us can solve these problems independently. We really need to be tackling the world of healthcare regulation, of politicalization, et cetera, in a collective way. And I think if we do, we might see some meaningful improvements over time. So thank you, Zubin, so much for your time. I know it's late in the afternoon your time. Thank you for joining us. Thanks to all of the registrants and others that have joined us today. And we'll look forward to continuing to work together.
And congratulations on your anniversary.
Oh, amalgaversary is what I'm
Amalgaversary,
called
yes.
tonight. Yes, yeah.
Congratulations. Thank you so much.
Thank you. Thank you.
Bye-bye.